Two papers in today's New England Journal of Medicine teach us something new about the way that Ebola virus might be transmitted. Ebola virus was first discovered in 1976, and since then we've had a good handful of outbreaks in Africa, and of course the most recent one that began in 2013 in Guinea has been by far the worst of all. Back in 1976 it was discovered that some male survivors of Ebola virus had the virus in their seminal fluid for some considerable time afterwards, often a period of a few months. And this observation was repeated in subsequent outbreaks. Of course, these outbreaks were really quite small compared to the massive outbreak that we've had in West Africa recently, where there's been about 28,000 people infected. And the information we had from the previous outbreaks didn't indicate whether this Ebola virus that was found in the seminal fluid of recovered male patients really was infectious. But now we have absolute molecular proof, forensic proof if you like, which is comparable to the kind of thing that would be acceptable in a court of law, forensic proof that Ebola virus in male seminal fluid is transmissible. The way that this was done was that a male survivor of Ebola virus in Liberia was tested to show that the virus in his seminal fluid was the same sequence with very, very few alterations to the virus that had appeared in his partner, his sexual partner, who unfortunately died of the disease as a result of sexual transmission from the recovered male patient. So this is smoking gun evidence that in fact, yes, Ebola virus in male seminal fluid is potentially infectious, and we now know this for the first time. So what are the implications of this for studies of Ebola virus epidemiology? Well, we've known since the 1970s that Ebola virus outbreaks tend to be followed by other Ebola virus outbreaks in roughly the same area within a short space of time. And this is a phenomenon that's appeared again and again since the 1970s. And we've never quite known why this might be. And one possible reason is that there are some male survivors of outbreaks who may have the virus in their seminal fluid for some months afterwards, perhaps as long as 9 months, according to one of the papers that's published in New England Journal of Medicine today. These survivors can then seed other outbreaks with bisexual transmission, which develop into outbreaks in their own right. Now, even if the virus in seminal fluid isn't as infectious as the virus in bodily fluids like blood and vomit and so on during a full-blown Ebola infection, even if the virus in seminal fluid isn't as infectious, the fact that it's sexually transmitted means that there is a potential for it to pass to partners, because in a domestic setting there may well be many potential transmission events. So even if the likelihood of a man transmitting it to his partner once is quite small, if there are repeated similar instances in a domestic setting, then the chances of transmission to a female partner over time becomes that much greater. So what this tells us is that we have to monitor the male survivors of the Ebola outbreak in West Africa very closely, make sure that they have the backup they need, for instance provision of condoms, that they have the sex education that they need, that they should know that they are potentially transmissible and that they may be putting their own partners at risk. And the other thing of course is that we now have a vaccine, which is still an experimental vaccine, but which looks like as if it's both safe and efficacious as far as we can tell in clinical trials, and that perhaps the partners of recovered male patients ought to be given access to that vaccine, which would give them an extra layer of protection just in case there was a potential of a transmission event within the family.